Hello and welcome to today's video. Over 60? 4 worst vitamins you should never take and 4 you must take daily. If you are over the age of 60, this may be one of the most important health talks you ever hear. When we're young, our bodies are very forgiving. We eat what we want, we recover quickly, and we don't think much about vitamins or supplements. But once we pass 60, the body begins to change in ways that affect how we absorb, process, and store nutrients. Our digestive system slows down, stomach acid is lower, and that means some vitamins are not absorbed as well as they used to be. At the same time, our liver and kidneys, the organs responsible for cleaning waste and balancing nutrients, are not as strong as before. They cannot handle high doses of certain vitamins. This creates a very important truth. The vitamins that help you at 30 or 40 may actually harm you after 60. In fact, research shows that millions of seniors are taking supplements they do not need, and in some cases, those pills are quietly damaging their health. But here's the good news. Not all supplements are dangerous. In fact, there are 4 vitamins that can truly protect your body, sharpen your brain, keep your bones strong, and even lower your risk of heart disease. So in today's video, we will go through the 4 worst vitamins for seniors, the ones you should stop taking, the 4 best vitamins, the ones you should take daily in the right amount. By the end, you'll have a clear, simple checklist of what belongs in your supplement cabinet and what should be thrown away. This video is not about selling supplements. It's about protecting your health with real science explained in a simple way. Worst vitamin. Number 1, vitamin E, high doses. Let's begin with one of the most popular supplements among seniors, vitamin E. For decades, vitamin E was advertised as a miracle antioxidant. You probably remember headlines saying it could protect your heart, slow aging, and even fight cancer. Because of this, many people started taking it daily, often in high doses, 400, 800, even 1,000 IU capsules. At first, it seemed harmless. After all, vitamin E is natural, right? It's found in nuts, seeds, spinach, and vegetable oils. Surely taking more should be good for you. But here's the problem. The body doesn't treat high-dose vitamin E supplements the same way it treats food. When you eat a handful of almonds or sunflower seeds, you get a small, balanced amount of vitamin E, just enough to protect your cells from damage caused by free radicals. Your body uses what it needs and leaves the rest behind. But when you swallow a large capsule of synthetic vitamin E, it floods your system with far more than your body was designed to handle. Unlike vitamin C, which is water-soluble and leaves the body through urine, vitamin E is fat-soluble. That means it gets stored in your fat, tissue, and liver. Over time, it builds up, and this buildup comes with serious risks, especially if you're over 60. The hidden dangers of too much vitamin E. Weaker immune system. While small amount of vitamin E support immunity, very high amounts can actually weaken it, making it harder for your body to fight infections. Prostate cancer risk in men. A large U.S. study, the SELECT trial, found that men who took high-dose vitamin E supplements had a higher risk of developing prostate cancer. Increased mortality. Multiple research reviews have concluded that people taking high doses of vitamin E supplements have a slightly higher risk of dying earlier than those who don't. For seniors, who may already have fragile health, this is a dangerous game. Why this is worse after age 60. After 60, your liver and kidneys don't clear out extra vitamins as efficiently. That means fat-soluble vitamins like vitamin E stay in your system longer. Even if you feel fine today, the risks quietly build up over months and years. If you've noticed that you bruise easily, your gums bleed when brushing, or you feel dizzy or weak after standing up, those can be warning signs of too much vitamin E, especially if you're combining it with blood-thinning medication. Safer alternatives. Now, does this mean vitamin E is bad? No. The problem isn't vitamin E itself. It's the high-dose pills. Here's how you can get vitamin E safely. Eat your vitamin E instead of swallowing it. Good sources include almonds, sunflower seeds, spinach, avocados, olive oil. These foods give you natural vitamin E in amounts your body can handle. Check your multivitamin. Many senior multivitamins already include a small, safe dose of vitamin E, usually around 15 to 30 IU. That's enough for daily needs. Avoid standalone vitamin E capsules unless your doctor specifically prescribes them for a medical reason. If you are over 60 and currently taking a separate vitamin E supplement of 400 IU or higher, it may be time to stop. Get your vitamin E from food and let your multivitamin provide the small backup dose you need. Your blood will be safer, your risk of stroke will be lower, and your immune system will thank you. Number 2, vitamin A retinol form. Now let's move on to vitamin A, another nutrient that sounds healthy on the surface, but can actually be dangerous if you take too much, especially after age 60. You've probably seen vitamin A advertised for eye health, skin repair, and immunity. And it's true, vitamin A is essential. Without it, your vision suffers, your skin gets dry, and your immune system weakens. But here's where things get tricky. Vitamin A comes in 2 very different forms. Retinol, preformed vitamin A found in supplements, liver, fish oil, and animal products. This is a ready-made form your body absorbs immediately. Beta-carotene, provitamin A found in carrots, sweet potatoes, spinach, and other colorful vegetables. Your body has to convert it into vitamin A, and it only makes as much as it needs. The danger comes from retinol-based supplements, the preformed vitamin A. Unlike beta-carotene from plants, your body can't easily control how much retinol it absorbs. If you take a high-dose pill, you're forcing your body to store the excess in your liver, and over time, this can cause vitamin A toxicity. Risks of too much retinol vitamin A. Bone weakness and fractures. Multiple studies show that seniors who take high-dose vitamin A have a higher risk of osteoporosis and hip fractures. Why? Because too much vitamin A interferes with vitamin D and calcium, the 2 nutrients your bones desperately need to stay strong. After 60, your bones are already more fragile, so this risk multiplies. Liver damage. Vitamin A is stored in the liver, and high levels can scar or damage it. Signs can include fatigue, nausea, or even jaundice, yellowing of the skin and eyes. Brain and nerve problems. Excess vitamin A can cause headaches, dizziness, confusion, or even balance problems. For an older adult, that could mean more falls and more hospital visits. Birth defects. For women still at childbearing age, while this may not apply to most seniors, it's worth mentioning that too much retinol is extremely dangerous during pregnancy. Why this is worse after age 60. Your body's ability to metabolize and clear fat-soluble vitamins like vitamin A slows down as you age. That means a dose that seemed fine in your 40s could become harmful in your 60s or 70s. And here's something most people don't realize. Many seniors take cod liver oil for joint health or immunity. But cod liver oil is extremely high in retinol vitamin A. Combine that with multivitamin plus fortified foods like cereals and milk, and you could easily be overdosing without even realizing it. Warning signs of too much vitamin A. Dry, itchy skin, cracked lips, headaches or blurred vision, nausea or loss of appetite, bone or joint pain, unusual fatigue. If you notice these and you're taking vitamin A or cod liver oil, that could be your body warning you. Safe sources of vitamin A. So, should you cut vitamin A completely? No, you do need it. But the safest way is through beta-carotene from food. Carrots, sweet potatoes, kale and spinach, red peppers, butternut squash, mangoes and apricots. Here's why this is safer. Your body only converts beta-carotene into vitamin A if it needs it. That means no risk of toxicity. You could eat 5 carrots in one sitting. Your skin might turn slightly orange, but you won't poison your liver. The smart move for seniors. Avoid standalone vitamin A retinol supplements. Check your multivitamin. Some older formulations include 100% of the daily value in retinol form. That's often unnecessary. Look for senior multivitamins that use beta-carotene instead. Focus on food sources. Colorful vegetables will give you a safe, natural supply. By avoiding high-dose retinol, you'll protect your bones, liver, and brain. 3 things that become more vulnerable with age. Number 3, vitamin B6, high doses. Vitamin B6, also called pyridoxine, is one of those nutrients people often assume you can't get too much of. It's water-soluble, meaning your body flushes out what it doesn't need. But here's the truth. With B6, especially in high supplemental doses, toxic buildup is very real, and the risks are particularly serious for adults over 60. Why seniors take vitamin B6? It's marketed for energy and brain support. Some supplements promoted for nerve health, depression, or even PMS relief. It's included in many multivitamins, B complexes, and fortified drinks. So it's easy to get more than you realize, especially if you're taking several products at once. The danger of too much vitamin B6. The recommended daily allowance, RDA, for seniors is only about 1.5 to 2 milligrams per day. But many supplements contain 50 milligrams, 100 milligrams, or even more, dozens of times the safe limit. And when that builds up in your system, it causes nerve damage. Here are the risks. Peripheral neuropathy, the most common danger. This is nerve damage that shows up as tingling, numbness, burning, or pins and needles in the hands and feet. For someone over 60, that can quickly increase fall risk and mobility issues. Balance and coordination problems. Too much B6 can damage the sensory nerves that tell your brain where your body is in space. Seniors may notice they feel unsteady walking or need support more often. Muscle weakness. Some people develop weakness in the legs or difficulty gripping objects. Cognitive confusion. High doses over time may also cause irritability, difficulty concentrating, or mood changes. Why this is worse after 60. Your nervous system is already more sensitive with age. Natural wear and tear, combined with possible diabetes, medications, or circulation issues, means the nerves are less forgiving. Adding high-dose B6 on top of that can accelerate damage, sometimes permanent. Even worse, symptoms often sneak up slowly. A senior may think numb toes are just old age or poor circulation, when in reality, it's B6 toxicity. Police car light warning signs of too much B6. Tingling, numbness, or burning in feet and hands. Trouble walking or needing to hold railings more often. Muscle weakness. Difficulty with fine motor skills. Buttoning shirts, writing. Mood swings or brain fog. If you're experiencing these and taking a B-complex or a high-dose B6 supplement, that's a red flag. Safe sources of vitamin B6. You can safely get vitamin B6 from whole foods without ever worrying about toxicity. Bananas, chickpeas, garbanzo beans, potatoes and sweet potatoes, chicken, turkey, and tuna, fortified cereals in small amounts. Food-based B6 is naturally balanced and won't cause overload. The smart move for seniors. Check your supplements. If your multivitamin or B-complex contains more than 10 to 25 milligrams per day, that's too much for long-term use. Aim for food first. Most seniors eating a varied diet get enough B6 naturally. Only use higher doses under doctor supervision. Sometimes neurologists prescribe B6 for specific deficiencies, but this should always be monitored. By avoiding high doses, you protect your nervous system, mobility, and independence, all critical to quality of life after 60. Number 4, vitamin E, high-dose supplements. Vitamin E is often advertised as a powerful antioxidant that can protect the heart, boost immunity, and even slow aging. On the surface, that sounds ideal for seniors. But here's the catch. When taken in high supplemental doses, vitamin E can actually become dangerous. And for adults over 60, the risks are especially serious. Why seniors take vitamin E? It's marketed for heart health and circulation. Some people believe it prevents Alzheimer's or memory decline. Others use it for skin and hair health. It's also a popular ingredient in anti-aging supplements. Because it sounds so beneficial, many seniors take high-dose vitamin E pills without realizing the risks. The danger of too much vitamin E. The recommended daily allowance, RDA, is only about 15 milligrams, 22 IU, per day. But many supplements contain 400 IU or more, nearly 20 times the safe amount. At that level, vitamin E stops acting as an antioxidant and starts acting like a pro-oxidant, damaging cells instead of protecting them. Here are the biggest dangers. Increased risk of bleeding. High-dose vitamin E thins the blood. For seniors already taking aspirin, warfarin, or other blood thinners, this dramatically raises the risk of internal bleeding, stroke, or brain hemorrhage. Higher risk of prostate cancer. It meant a large clinical trial, the SELECT trial, found that men who took high-dose vitamin E supplements had a 17% higher risk of prostate cancer. Possible increased risk of heart failure. Some studies suggest that high doses may worsen outcomes in people with heart disease instead of helping them. Weaken immune function. Paradoxically, excessive vitamin E can impair your body's ability to fight infections. Why this is worse after 60. Seniors are more likely to be on blood pressure or blood-thinning medications, making the bleeding risk much more dangerous. Natural clotting ability decreases with age, so the body can't buffer, overdoses as well. Many seniors are already managing chronic conditions like heart disease, diabetes, or cancer risks, which makes adding another risk factor very harmful. Warning signs of too much vitamin E. Easy bruising. Frequent nosebleeds or gum bleeding. Feeling unusually weak or fatigued. Dizziness or vision changes from internal bleeding. In men, prostate health changes, urinary issues. If you notice these and are taking a high-dose vitamin E supplement, that's a red flag. Safe sources of vitamin E. The safest way to get vitamin E is through whole foods, almonds, hazelnuts, and sunflower seeds, spinach, kale, and other leafy greens, avocados, olive oil, and sunflower oil. Food-based vitamin E is balanced with other nutrients and doesn't carry the same risks as concentrated pills. The smart move for seniors. Avoid high-dose vitamin E supplements. Anything above 200 IU daily, especially 400 IU or more, is risky. Stick to food sources. A handful of nuts or a drizzle of olive oil gives you natural vitamin E safely. If you take a multivitamin, check the label. Make sure vitamin E is close to the RDA, around 15 milligrams or 22 IU. Only use higher doses if prescribed by a doctor for a medical condition, and only under close monitoring. By avoiding high-dose vitamin E pills, you dramatically lower your risks of bleeding, cancer, and heart problems, while still getting enough from healthy foods. 4 best vitamins seniors should take daily. Number 1, vitamin D. Vitamin D is sometimes called the sunshine vitamin, and is one of the most important nutrients for seniors. As we age, our skin gets less efficient at making vitamin D from sunlight, which means deficiency becomes very common after 60. Why it matters. Bone health. Vitamin D helps your body absorb calcium properly. Without it, bones become weak and brittle, increasing the risk of osteoporosis and fractures. Immune system. It supports your immune defense, helping your body fight infections like colds and flu. Mood and energy. Low vitamin D is linked to depression, fatigue, and muscle weakness. Where to get it? Sunlight, 10 to 20 minutes a few times a week. Fatty fish like salmon or sardines. Fortified milk or cereals. Supplements, usually 600 to 1,000 IU daily, sometimes more if your doctor checks your levels. Number 2, vitamin B12. Vitamin B12 is often called the energy vitamin because it plays a big role in keeping your nervous system and red blood cells healthy. The problem is that as you get older, your stomach produces less acid, which makes it harder to absorb B12 from food. That's why deficiency is very common in people over 60. Why it matters. Brain and nerves. Prevents memory loss, confusion, tingling, or numbness in hands and feet. Energy and blood. Helps make healthy red blood cells, preventing anemia and fatigue. Mood. Supports mental clarity and reduces the risk of depression. Where to get it? Animal foods like eggs, fish, poultry, and dairy. Fortified plant milks and cereals. Supplements. Seniors often need 1,000 micrograms daily, sublingual drops or tablets. Number 3, vitamin C. Vitamin C is one of the most famous vitamins, and for good reason. It's a strong antioxidant that protects your body from damage and keeps you feeling youthful and energized. Why it matters. Immunity. Supports your immune defense and helps fight off infections. Skin and healing. Boosts collagen production, which helps wounds heal faster and keeps skin firm. Absorption. Improves the body's absorption of iron, reducing the risk of anemia. Where to get it? Oranges, kiwis, strawberries, bell peppers, broccoli. Supplements. Usually 500 to 1,000 mg/day, but avoid very high doses, which may cause stomach upset. Number 4, calcium. Calcium is the building block of bones and teeth. After 60, bone density naturally decreases, especially in women after menopause. Without enough calcium, the risk of osteoporosis, fractures, and mobility problems goes up. Why it matters. Strong bones and teeth. Protects against bone loss and brittle teeth. Heart health. Plays a role in steady heartbeat and blood pressure regulation. Where to get it? Dairy products, milk, cheese, yogurt. Fortified plant milks, soy, almond, oat milk. Leafy greens like kale and bok choy. Supplements, 500 to 600 mg/day. Always pair with vitamin D for absorption. If you found this video useful, make sure to give a like, share it with someone who might benefit, and subscribe for more simple senior health tips. Stay healthy, stay strong, and I'll see you in the next video.